your members include all of these airliners from Asia. Is it fair to say that at this point, the hardest hit would be those Hong Kong and Chinese airlines like Cathay or China Airlines?
Yes, I mean, obviously the epicenter is in China, so all of the Chinese carriers, the domestic travel is a huge market. The world's second biggest domestic market after the United States. And of course, to and from China affects other airlines, particularly Asian airlines with very dense networks, inclusive of China. So you mentioned the figure for within China. The impact elsewhere is more muted, but it's still very, very significant.
Can you at this point quantify the loss?
It depends on how much the scope of what you include. But if you take all of Asia Pacific, that would be about a third of global travel, and China would be almost half of that figure. So overall, if China's down 50%, then that would be about 25% impact on the whole of Asia. And as you mentioned, China's currently down more than that. So we're talking a very significant fall off. Airlines have had to cut back on services. And the situation's also been compounded by the fact that many governments have introduced travel restrictions against the advice of the WHO, and that's also complicating matters from an airline perspective.
Andrew, when you look at the airline business, I mean, it is a notoriously difficult business to be in, and you're seeing the likes of Virgin Australia, for example, cutting its Hong Kong, Australia routes. Are some of these sort of consolidation measures being taken, and the coronavirus is really kind of introducing an apt time to do this, whereas some of these measures might be taken anyway to tighten up their businesses?
Well, as you say, it's a paradox that the industry grows, doubles in size every 15 years, but it's an intensely competitive industry, and airlines are always striving to maintain profitability, even in good years. So those challenges are always there. This, of course, is an entirely unpredictable shock to the industry, but we've had similar shocks before in the past with SARS and so on, or other natural disasters. So the industry has a definite strength and resilience, and will recover and recover quickly as and when the circumstances allow. In terms of the focus is very much on the short term, responding to a rapidly evolving situation. The strategic outcomes, consolidation in the industry, I think that's a separate discussion, which was true before this outbreak and will be true after.
The situation evolving every single day. We have new numbers out of China right now. 35,982 confirmed coronavirus cases, also 908 deaths as of February 9th. Again, the death toll rising to 908. And the confirmed cases of coronavirus within China at 35,982. These numbers coming out of China. Of course, we get a daily update now on the severity of this outbreak. Andrew, so let me ask you, how are you advising your member airlines to help ensure the health of passengers?
Well, the health of passengers and our crews and the traveling public, the public more generally, is uppermost in our minds. We have well-established guidelines, international guidelines on how to respond to outbreaks. Air travel is extraordinarily safe, and that includes from the point of view of infectious diseases. Airlines have stepped up in accordance with those guidelines, cleaning and other preventative measures. But the basic advice to travelers from WHO is the same as the advice on the ground, which is to wash your hands frequently and think about etiquette, particularly if you have coughs or sneezes and so on. So it's no different from other elements. Of course, if someone's discovered to be symptomatic on a flight, there are procedures for what to do with that person as and when you arrive, and so on and so forth. But the main thing is simply trying to maintain connectivity in accordance with WHO's recommendations, and then responding to the demand as we see it.
Andrew, the fatalities have already exceeded those of SARS 17 years ago. We don't quite know how long this will go for, although it's worth pointing out that we have seen a slowing when it comes to the number of cases and fatalities being announced in the last couple of days or so. How quickly can the industry bounce back from a challenge like this?
Well, I remember SARS. I was in Hong Kong at the time, and if we look back at that experience, the duration was about 3 to 6 months. There was a very, very sharp decline, and once we were in that phase, it was very hard to imagine it bottoming out and what form the recovery would take. With hindsight, we can see the recovery was equally dramatic, and within 6 months, the traffic was back to its pre-crisis levels. So whether this one will play out the same way is obviously unknown, but it's a reminder that we do need to be prepared. And as I said before, this industry is very resilient. And just as we can cut capacity and adjust, we can similarly deploy capacity back into the marketplace. It very much depends on the progress of the disease and the outbreak. And of course, it depends on public sentiment. But again, the evidence was that just as fear spreads rapidly when you get an outbreak of this kind, confidence is restored by a similar mechanism, social mechanism. And we saw at that time a very quick recovery and full recovery. So we need to be prepared for that, but just to emphasize, we don't know, and we'll take guidance from the medical professionals who are obviously monitoring closely, not just daily developments, but modeling the likely trajectory. But it very much depends on the success of the efforts, the medical efforts to contain the outbreak.
Andrew, a lot of the conversation has been centred around consumption, tourism, passenger volumes being affected. What about air freight? Because last year was a terrible year for freight, obviously because of the trade war. We had the phase 1 trade deal being signed and things were supposed to be looking up. How much does this impact the freight side of the business, given that we are starting to see supply chains being disrupted, production being disrupted for manufacturing, as well as on the demand side of things coming down as well?
Yes, I mentioned Asian airlines are carrying about a third of the global passenger traffic, and they're carrying a similar proportion of global air cargo traffic. It was a tough year for air cargo because of the trade disputes. Air cargo globally was down about 3%. Asian airlines saw a fall of about 5% in traffic volumes of air cargo last year. We were expecting a modest upturn this year in terms of the impact. Obviously, supply chains have been disrupted, and anyway, a lot of factories shut down for Chinese New Year. So it's not obvious at this stage the supply side of things. In terms of the capacity, the cuts in the passenger services takes a lot of belly capacity, freight capacity out of the marketplace, and it may be necessary to deploy additional freighter services to meet demand. But at the moment, it's early days in terms of assessing what the impact is on the disruption to supply chains. That will ripple out. You've already heard from people all around the world how it may affect their supply chains. Again, the air cargo industry is used to volatility and will respond accordingly. And it may be that additional freighter capacity, but there is more than adequate freighter capacity available because, as I say, last year we saw a downturn in volumes. And freighters, there is plenty of freighter capacity available. We also need to be mindful of the fact that some governments have put restrictions on cargo flows, again, against the recommendations of the WHO, and that's something we need to address.
Andrew, so just finally, we have seen Israel now widening its travel warning to other Asian destinations, including Thailand, Japan. How concerned is your association that more countries will put more travel restrictions to other Asian destinations? And are you talking to governments about this?
Yes, we're very concerned because the WHO have recommended no restrictions on travel or trade. There is a mechanism within the international health regulations that governments, if they wish to impose travel restrictions, need to inform the WHO within 48 hours. And from reports we've seen from the WHO, many countries have not been keeping them up to date with those measures. And it's also recognized within the international health regulations that the WHO can ask for the public health rationale, the justification for such measures. We need more dialogue on that subject because some of these measures, whilst they're well-intentioned, are counterproductive. They're not effective from a public health point of view in fighting the disease outbreak, whereas they do cause significant disruption to the wider economy and to people's ability to get on with their daily lives. So that is an issue. We understand why some of the governments feel the need to introduce it, but we have to look at what's the impact and the wider impact way beyond travel and tourism.